Good morning. It's Dr. Rutledge here in sunny Southern California and saying hi to you to talk about iron deficiency anemia after the mini gastric bypass. So I'm going to share my screen and start talking about that. So give me 1 second. Okay, this is what I want to start and summarize everything. Say, basically, it's simple. In other words, a lot of people get confused, and we have lots of people getting forced iron and intravenous iron and told to eat lots of meat and take iron pills and things like that. But it can be a lot more simple than that. Sometimes those things are necessary, but a lot of times there's just some simple things to know. So, and also we might mention taking some ginger. But okay, after the MGB, some people do get low iron and iron deficiency anemia. It happens, okay? That's important. It can happen. You should be careful about it, and you should know the symptoms, like you get tired and weak and pale looking. You look at your eyes in the mirror and there's not the little red lines of blood vessels, and people say, you know, you look like a vampire and you're pale. That's a bad sign. So be aware it can happen. And get your blood tested for all of the vitamins and minerals on a yearly basis, as we say in our manual. Now, something number two, which you should know, is number one, you can get it, but the other thing is almost never in men. Okay, so this is a hint. So those of you who are following along at home, heads up. Some people do get iron deficiency anemia. It turns out about 10% of people around the world get it. And who gets it? It's almost never men. Men can get it, but there's a big hint here, okay, about how to treat it, how to prevent it. In my series, maybe 1 or 2 out of several thousand patients has gotten iron deficiency anemia. Almost no men. Many women get iron deficiency anemia with or without MGB. Okay, wait for it. Wait for it. Why? Okay, this is as easy as 1, 2, 3. Women have a leaky bucket. So to try and make this really simple, because a lot of people call me and they're confused and upset and things like that, but it's really, really simple. Women get it so much more often with or without MGB because they have a leaky bucket. Okay, that's a silly analogy. I hope you'll forgive me, but it's meant to make something really simple. Menstruation, a monthly cycle, leads to monthly blood loss, and blood is iron. Okay, so women get it whether they have an MGB or not. It's much more common because they are losing iron in their menstrual cycle every month. Okay, so if you have a leaky bucket in the backyard, for example, one solution would be to continuously add more water to the leaky bucket. Or, wait for it, yeah, you could patch the hole in the bucket. Okay, so that's where we got now. See, number 4, it's not hard. Patch a hole in the leaky bucket. That means in our discussion topic, decrease the monthly menstrual blood flow. This is a good idea. This is simple. Okay, so you go to your gynecologist, and there are a variety of therapies, and we'll go through them quickly, but cut down on your blood loss and you won't have to get intravenous iron. And then I say as a joke, I hope you won't get angry at me, we just need to make women more like men. It's a joke, don't get angry. Okay, I know, I apologize. It's a bad joke, but it's kind of funny though. All right, so let's say this again. Iron deficiency causes lots of frightened, worried phone calls, emails, comments. What can I do? What can I do? Let's make it simple, okay? 1, some people with or without an MGB get low iron and anemia. Almost never men almost always women. Why? Women lose iron, blood every month in their menstrual cycle. The treatment is to patch the hole in the leaky bucket, that is, decrease monthly menstrual blood flow. Okay? How do we do that? Well, let's look. All right. So the other big word for this is menometerasia. And that's not exactly right, because that means a lot of blood loss. In many women who have an MGB, they don't have a lot of blood loss. They just have some blood loss, but it's too much for their iron intake. Okay? So, but we know how to treat this. The leaky bucket syndrome is very common in women. They get iron deficiency anemia commonly, and we know how to treat it. Okay? Let's go through the treatment. One, you can take NSAIDs. What are NSAIDs? Well, it's like Motrin and things like that. Ibuprofen, naproxen. This can help decrease the blood loss. All right, it's easy, simple. You don't take it forever. You don't take it every day of the year. You take it when you have your cycle. And you would discuss this with your gynecologist ahead of time. Now, can taking lots of non-steroidal anti-inflammatory drugs like ibuprofen and naproxen increase your risk of bleeding a little bit? Yeah, but you can prevent that by doing some of the other things we're going to talk about, which is basically eating a healthy diet. So we'll talk about that. But this is one really simple thing. When it comes your time of the month, doctor will prescribe, you could decide to take some non-steroidal anti-inflammatory medicines like Motrin, okay? The next choice, which is really common, is birth control pills. Presumably, you're not getting pregnant every month. So on those months when you're not planning on getting pregnant, then you could, if you wish, take birth control pills, okay? It's very effective. It decreases the blood loss and it fixes the problem. If you have let things go a long time, you might need extra iron to get back to normal, but then you don't want the bucket to leak again, right? So birth control pills. Progesterone is another female hormone. This can also reduce heavy bleeding. There's another drug called tranexamic acid. This can also decrease blood flow. You can put in a hormonal IUD. The hormonal IUD releases just a little bit of the progesterone type hormone locally into the area, so you don't get the effect of the hormones throughout the body. So this is a good way to do it if that's convenient for you. Sometimes you might already be taking some other hormone and you could stop it. And of course, you can take some extra iron, but I think that's not commonly necessary if you pay attention to these other things I've told you so far. In big cases where people are having lots of bleeding, you can actually send a blood clot into the lumpy fibroid that's in the uterus causing this problem. And that can be done in the radiology laboratory. Sometimes they'll actually take out a lumpy fibroid, and occasionally they'll actually interfere with the uterine lining or even take it out, which is called a hysterectomy. But I haven't seen that be necessary. Just these other simple things. Remember this, you could take some Motrin, not on your own, talk to your gynecologist. You could take birth control pills, progesterone, tranexamic acid. You could have a hormonal IUD or other things. It's really, really simple. It causes a tremendous amount of confusion. In my experience, it's really simple. So I'm just going to say it one more time. Iron deficiency anemia is very common. Up to 10% of American women have iron deficiency anemia. The cause is you're weak and tired, grumpy, you don't feel like you can get through the day, and it's very debilitating. You look pale and sickly, you're not happy, and it's easy to fix, okay? How do you fix it? Number one, non-steroidal anti-inflammatory drugs, birth control pills, progesterone, tranexamic acid, an IUD with hormones, or changing your medicines. All of those are really simple, really easily done. This causes a tremendous amount of confusion. People are getting intravenous iron, all kinds of things. You don't have to do any of that if you just stop the leaky hole in the bucket, okay? Now we have some more things to comment on, but I hope that helps get started now, okay? So now we're going to stop sharing. Click back here for 1 minute. Let me close this up. Close that. Close that. Now, there are some other things when you're taking your iron. Sometimes your doctor may tell you, oh, you should take extra iron. And there's a couple of things to know about that. So we're going to share a screen again. Number one is, can infection cause low iron? So I said it was really simple. You're just losing too much blood in your menstrual cycle. But you should look out for these other secondary things. Almost always, it's a woman and it's too much blood loss in the menstrual cycle. There can be other things, though. And one of them is if you get increased inflammation, that will interfere with iron absorption. And also, the body will turn down its own iron in the blood. So if you get inflammation, the body will decrease the iron in the bloodstream. Why? It's a natural response to protect itself from invasion of bacteria. So when we get bacteria inside of us, that's bad. That's an infection. That's also called sepsis and can cause death. Your body has seen this over the millions of years that we've been people. And what they learned is bacteria need iron. They can't live without iron. We can live without iron for a while. So what happens is when we get an infection, we get inflammation to attack the invaders, we automatically decrease the iron in our bloodstream, okay? So when you get inflammation, the body says, warning, I might be being attacked by bacteria, so it cuts down the iron in the bloodstream. Okay, sounds good. But what if you're not having an infection? Well, it turns out some food turns on the inflammation pathway. So guess what foods turn on the inflammation pathway? Right, meat, dairy, and eggs. When they come into the body, many times they release a chemical from the lining of gram-negative bacteria called endotoxin, like toxin. This chemical, which is in bacteria of a particular type, gets into the bloodstream every time you eat. And I have some videos on that. There's a guy named Dr. Michael Greger, he talks about this. And basically, when you eat meat, you get a burst of endotoxin in your body. And there's a lot of bad things about that. But one of the things it can do is it can help make your anemia worse. Okay? So let me say this again. When your body thinks it's being attacked by bacteria, it cuts back on the iron. So it decreases your iron, even if you're taking lots of iron or getting intravenous iron. So another thing that can happen is your body says, I'm getting inflammation, warning, warning, cut back on iron. And so we don't want that to happen. So guess what you should do? Eat less meat, dairy, and eggs. So if you're having increased inflammation and the iron is not coming up and you cut back on your blood loss in your menstrual cycle, then one thing you can do is you could cut back on those inflammatory foods and eat non-inflammatory foods. And we'll talk about some other things you can do. So now let me stop and go to the next topic. There's a lot more research on that and I could talk about it later, but if you're having trouble and the leaky bucket doesn't fix everything, which it does in 99% of my patients that I talk to, it could be inflammation going on. So let me stop that for a second, come back here and tell you something else, which is when the doctor tells you to take your iron, you need to remember oh, sorry. And we need to share this screen. Oh, there it is. Okay, sorry. Okay, we need to remember you can't take your iron pills with calcium. Okay, milk, calcium, and acids should not be taken at the same time as iron. Should wait at least a couple of hours. And the reason is that the calcium blocks the iron absorption. So you're taking iron pills, but nothing's happening. So this is just a warning. If you are taking iron pills, you'll want to take them with a meal, usually with, your fresh fruits, vegetables, or whole grains, and not take them with a calcium pill, not with dairy or other things like that, like antacids that has calcium in it. Okay, let me stop that, and that's next. Okay, the next thing we're going to talk about is that there is a strong relationship between your blood level of vitamin A and iron deficiency anemia. And I have a lot of slides I can show you on that, but if you have low vitamin A, your body will not be able to keep enough iron and will get a low blood count and low iron. So what this means is you should eat a healthy diet. Where do you get vitamin A? Well, vitamin A is actually broken in part of a chemical called carotene. I wonder where carotene comes from. Right, carrots and other yellow vegetables. So when you're thinking about your iron and your anemia, one of the things to be concerned about is make sure you're eating a healthy diet, particularly increase the amount of fresh, whole vegetables, particularly the bright yellow colored ones, because that has the carotene in. Okay. Any other thoughts on this? I'll just summarize again. This is a really simple problem to treat, but a lot of people get confused about it, or the doctors are not too up on the latest here, and they end up pushing a lot of intravenous iron and pills of iron and things like that. And usually it's easily fixed. So let's just summarize again, because I recently got some phone calls and confusion about this. Number one, iron deficiency anemia is common around the world, common in America, but it's common not in men, but in women. It's a woman disease. And it's a woman disease, not because anything they're doing wrong, but because they have a menstrual cycle. And when they have the menstrual cycle, they bleed, and they bleed blood, and blood has iron. So every month you're losing iron, and that's bad. Well, I mean, it's not bad, but it means you have less iron in your bloodstream than a man. The way to fix that in my series of over 23 years is really easy if you talk to me and your doctor and explain what's going on. All you got to do is decrease the amount of menstrual blood flow. Okay, as soon as you do that, your iron will come back up and you'll be fine. You don't have to take any more. If you've gone a long time, it can take some intravenous iron to catch up. But once you realize this is the problem, it's pretty easy to fix. Okay. If this isn't clear, or if your doctor's not clear on it, call me anytime. But there's some things you can do to cut down your menstrual blood flow, and it depends on your preferences and things like that, but it's really easy to fix. Just call me. The other thing to point out is low vitamin A, which is common in healthy green, yellow, brightly colored vegetables. Vitamin A makes a difference and increases the risk that somebody's going to get low iron. The other thing is that when you are inflamed, when you are getting the signs and symptoms that your body thinks it's being attacked by a bacteria, then your body will cut down on your iron, even if you're taking iron and getting intravenous iron. So if you get a complex problem where you're getting iron and your iron's not coming up, it might be worthwhile calling me for a consultation, and maybe I can help explain what's going on to you and your doctor. So don't hesitate to call if you are getting trouble getting your iron back up by just plugging the leaky bucket. It can be occasionally complicated. Usually healthy diet, healthy diet, healthy diet. Eat a healthy diet and stop bleeding so much in your menstrual cycle, and that'll take care of it. Thanks very much, and I hope you enjoyed this, our second of the beginnings of our new podcast, and we'll talk to you soon. Bye-bye.